We're back with treatment to the hand. We're using the 15mm convex head again. We're going to enter our settings into the machine just as we have done on the previous treatments. You see we need to bring the pressure down here to 1 bar, equivalent of 60 millijoules, coming down to 2000 shocks, and we're going to go at 10 Hertz again. We're back, the hand here, treatment between the 4th and 5th metacarpals. Put some gel on, spread the gel out, and start with treatment to the hand. The central part of the gutter between the two metacarpals seems to have cleared, and there are two focal areas now of discomfort, one down at the proximal phalangeal joint and one up at the carpo-metacaral joints. We're going to try and concentrate on those two areas today by adding a little bit of shockwave into each. We'll do as much as we dare, come up to the area, and just loiter on the area for a few shocks. You can see the pain in the patient, you can actually see the hand twitching as we come onto that area. You'll probably see the patient gesturing, so that's the painful area. And then down at the bottom, there appears to be a small lump at the bottom, a lump of scar tissue. We believe that's onto one of the tendons, actually, for one of the long finger tendons, probably one of the adductor tendons. We'll concentrate on that small area, although that does tend to be extremely painful. And then we come back up to the carpo-metacaral end and concentrate on that area as well. Like I said, the scar tissue in the gutter seems to have cleared. There's a definite gap now between a distinct gap between the two metacarpal bones, and the patient is much more able to make a fist. His strength is coming up in his hand. His strength is returning. His grip strength, his power grip strength I should say, is returning. And overall he's very pleased with the progress. To say for a year he really hasn't made any steps forward. This treatment seems to be working very effectively. So this is the 4th treatment onto the hand. We will be videoing the whole series of these and putting them up onto YouTube and the website. Once again, you can see us concentrating on the two most painful areas. You see the patient actually moving his arm because of the pain. Let's say the whole thing is much less tender than it was originally when we found it very difficult to tolerate treatment anywhere on the gutter between the two metacarpals. And we just keep moving here until we finish off the 2000 shocks.
But I can actually see the groove in between the metacarpals now, which you didn't have originally. I keep coming back to it, don't I? Yeah. This bit is bad up here though. I mean, last week you couldn't tolerate this at all. I was on this for a few seconds, and this week I'm on it a lot longer. Yeah. Yeah. Much better. Much better. I'll just keep dabbing this one at the bottom until it settles a little bit. There we go.
Wow.
I've got your spare piece of tissue today.
What a piece of kit.